Many IVF patients are worried that the IVF cycle is very stressful. So let me just break this up. Stress can be two things. One is mental stress and the second is physical stress. The physical stress is often because they need to go every day to the clinic for blood tests or for ultrasound scans or for injections, or because the doctor gives them very painful intramuscular progesterone oily injections, which means they can't sit on their butt. So that's one set of stress. Now, the good news is all this is completely unnecessary. So, for example, we don't use any intramuscular progesterone in our clinic. We use progesterone as a vaginal pessary, so there's no pain. We don't give those painful subcutaneous heparin injections which cause so much burning and bruising because it doesn't help at all. And we encourage our patients to self-administer their own injections, which means they only come to the clinic 3 or 4 times during the entire IVF cycle. So not only does this save them money and time, it obviously reduces stress levels because they don't have to sit and wait for the doctor, they don't have to sit and wait in traffic, they don't have to waste time commuting, which is how we can reduce their physical stress levels. And equally importantly, we reduce their mental stress levels. And we do that by prescribing information therapy, which is why we call ourselves a stress-free clinic. Which means if patients have realistic expectations of what's going to happen next, what the doctor is doing and why they're doing it, their anxiety levels go down because they're in control. They know what's going to happen. And I think this helps. And part of the reason IVF cycles are so stressful is because doctors refuse to share information. They use too much jargon, they cloak what they're doing, as a result of which patients are completely clueless, don't know what's happening and whether things are happening well or not. And it is this opacity which adds to stress levels. Whereas in our clinic, we're very transparent, we share a treatment plan well in advance, we tell the patient what's happening during every visit, and we give them embryo photographs to document that we provided them with world-class quality care.